Hello. My name's Jordan. I'll be your student nurse today. Can you please state your name and date of birth?
Okay. Remove that whole tape.
Alright.
So I want to go ahead and measure
And are you allergic to anything?
from the tip of the nose to the
No.
process.
Alrighty. And do you have any pain? Alright. Well, we're going to try to relieve some of that pain for you today. We're going to be inserting a nasogastric tube
So that is about
with irrigation.
40 centimeters.
I'm going to raise you up
I
here.
would go ahead and make sure to measure that with one of the readings.
Okay. I'm going to lean you up just a little bit.
And I would use a tape to put it.
Alrighty. And then before I inserted the gastric tube, I'm going to assess the abdomen, just check for
So then I would go ahead
distension,
and ask the patient to
make sure that there is, check for vowel sounds in each quadrant for a full minute, just to make sure, since we're going to put something in there.
There is no.
So, we'll roll this down. And then I'm going to inspect first, make sure there's lesions, distension, that type of stuff. And then I'm going to auscultate. So I'd auscultate in all 4 of the quadrants for a full minute, just to make sure I get a proper assessment.
Shelly, ask the patient what patient is he which narrative is easy for them to breathe out of.
So I'm going to set him up just a little bit more, just to prevent any cause of like aspiration, stuff like that.
So then I'm going to go ahead and lubricate it 2 to 4 inches.
So I'm going to set this on the patient.
Okay.
I'm going to have this emesis base in there just to make sure that if he needs to cough, spit up, throw up, anything like that, he can catch it.
Go ahead and just move your head forward, down to your chin to your chest. Alright, sir, go ahead and
I would also have a cup with some water right here. That way when we're placing the tube, they have the option to swallow, just to help ease that tube down into the stomach.
So it's not actually going to go all the way. As far as it goes.
Okay.
I don't want to let it go.
I'm going to get my tube ready here. Alrighty, and the way I'm going to measure my tubing to make sure I get in the stomach is I'm going to measure it from the nose to the ear,
To note the outside measurements.
and then I'm going to go from the ear to the xiphoid process. I'm going to mark this with a piece of tape. Okay, we're at about 40, which is about normal. The length depends on the height of the person. So I'm going to lay this tubing right here.
So,
I'm going to turn on my suction.
So make sure to just document that.
120 to 125 for the adult.
And then
Make sure
I'm going to go ahead and
everything's
flush.
working.
Or actually no, I would actually aspirate
Alright.
if we got gastric junctions. So of course
Okay.
I would get an open syringe.
So this would just
and
act
this
as my
is just
cup
check for
right now
medications.
with
This
the
is- So I'm just gonna go ahead and
straw in
get
it.
my syringe.
So I'm going to open this up
Yeah.
just so I have it ready.
Go ahead and close it.
Okay, I get my tape ready here.
And then I'm going to go ahead and take my pH strip to the little
I'm also going to attach a pulse oximeter to the patient and have the patient be wearing that throughout the procedure, just because we're going into the nose, which can cause respiratory distress and things like that.
Okay, so I want to just go ahead and place that there. I'm going to give it a minute or so. And then I want to make sure
So
that it's
before
less than
I
will show that it is in the stomach.
Before I insert this, I'm going to ask them if they have a preferred nair that we use, just because if they have one that they're having trouble breathing out of, we don't want to occlude both nostrils. So for the mannequins, this one's going to act as my lubricant. I'm going to spray it just on there.
I'm then going to go ahead and flush with.
In real life, I would use this lubricating jelly.
Water. So I'd go
Okay.
ahead and.
So I'm going to have the patient lean their head back. And then when I reach the gag reflex, I'm going to have them do chin to chest and then take a drink of this water right here. So deep breath, we're going to go in. And then I'm going to hold this right here. I don't want to let go of it. If they sneeze or cough, it could fall out. Procedure is kind of painful, so we don't want to have to do it more times than we should. So I'm going to hold this.
Until it rains clear. Okay, so now that I've done that,
Into place. I'm going to tape it.
I would then go ahead and make sure that the blue air vent is also flushed as well. Just to make sure that there's no anything backed up. So I would go ahead and just take about 10 mils of air.
So I want to make sure when I'm taping that I'm not occluding that nostril that's open. This is my bridge tape.
I'm going to go ahead and
Okay, so now I've got my tube in
Never
place.
want any liquid
So I'm going to document the
blue air vent.
measurement that it is inside of the patient, and I'm also going to measure
Then I'm
what's
gonna go ahead and
outside.
take the suction.
The outside measurement
So here I have my
allows,
suction.
if the patient is transferred or moved,
And
it
it's
allows
I want us to
the
get this
people of care to see if it has
above the
moved
abdomen, so I can
and
do
whatnot.
a safety
So
pin or anything, just,
I'm going to take out the stopper.
So once I've done that, then I would go ahead and leave the
Okay.
patient in this position
So I'm going to take my syringe.
for however long the order said to keep it in, and I would come back and assess the patient every 30 to
And
hour.
just check this. We want to cause less pain as possible. So
Reassess the abdomen, and once
right now I'm going to check for gastric. I want to make sure that I'm in the stomach. So I want anything 5.5 or less. That just assures me that we're in the stomach and that we're not getting, messing with anything other than the stomach. So I'm going to use the emesis base, and I'm going to aspirate a very small amount of contents.
ask the patient for the healing.
I'm going to put it on this pH strip. So it's been confirmed that we're in the stomach. Okay, we're at a 5 pH.
So now that I've done
I'm
that,
going to include this just for a second to keep anything from coming up and whatnot. Okay. So we always want to measure accurately what we're putting inside. That way we know it to get out. So I'm going to irrigate this tubing, and I'm going to irrigate it with 20 to 30 milliliters. So I'm going to go about 25 right in the middle.
perform hand hygiene. Just make sure that the suction is where
Okay.
it needs to be.
So that, and then I'm going to put it in my syringe.
How long was it?
Okay, and I want to make sure I get most
I
of
think
the
it's all the
air
the assessment stuff that did.
out of here, and that should hit me at about 25. Okay, so I'm going to take out the stopper on the tubing that's going into the stomach. I'm going to irrigate it. So all of that is in now. Okay, so I irrigated it. Now I'm going to occlude that with 10 milliliters of air. I'm going to
I would say it's safe to get the whole meter.
just kind of irrigate that out, just the rest, the air vent, just to make sure. And then, so I'm going to connect this to suction. So we're going to be sectioning out any contents in the stomach. So this could be a continuous suction. So I'm going to tape this to the patient just to kind of have some stability here. So I'm going to leave this. If the patient were unconscious or irritated or something, I might have a sitter, and we want to make sure that they don't pull that tubing out, just because we don't have to put it back in again. I'm going to check the placement, and then we would, whatever's in has been aspirated, we would like assess it for color and odor and, you know, amount, that type of stuff. Okay, so I'm going to leave the tubing in place. I would leave and come back, and then I'm going to take it out. I'm going to remove the gastric tube. It's done its job, and so we're going to take it out. I'm going to take it out of suction. I'm going to immediately occlude it. I'm going to clamp the tubing. That way we don't keep getting gastric contents out. So I am going to, so before I flush it, I'm going to measure out again 10 milliliters. 10 mils of water, and I am just going to I'm just going to flush this just to get anything that might be left in the tube. We want to make sure we put that all back in there, and then just flush the tubing out. And then I'm just going to flush this one more time with just some air, not water. So as the procedure is kind of painful, the removal is kind of just uncomfortable, so I'm going to just have them hold their breath. Just hold their breath, kind of bear down, and then we're just going to come out swiftly, not too fast, not too slow, like that. And then I'm just going to roll it up in my gloves, just because it's got, you know, it's been inside the patient. So I'm going to do that. Hand hygiene. I'm going to clean up. Throughout that procedure, I would have been monitoring the pulse ox just to make sure it didn't plummet. And then I'll take the pulse ox off. And then I could do another focused abdominal assessment just to make sure, or just to see the difference before and after the procedure. I'm going to leave the patient in high Fowler's position. We're going to do a feeding. I'm just going to lower him down just a little bit. Call light in hand, federal strap. And you just let me know if you need anything, okay?